One evening, a man walked into our home in a small village and offered my father, a mathematics teacher, a bag full of money to raise his son's 10th board exam marks. My father calmly refused, choosing integrity over money. I was just 10 and watched this from doorway and learnt my first lesson. That evening became foundation of my life where I learnt because lives aren't transactional, honesty and integrity are priority over money. Years later, I learnt my second lesson. After completing my MBBS and MS, when I was doing neurosurgery residency in Mumbai, one of my professor in pediatrics had a rare disorder that could not be diagnosed despite being seen by multiple consultation, multiple specialists eventually. She traveled to Mumbai where I had an opportunity to accompany her to this renowned specialist. That specialist listened to her carefully, examined her in details, went through all investigation and eventually reached a diagnosis. My professor was visibly very happy with the experience and she offered me an invaluable piece of advice and said, Rakesh, wherever you settle, be it in a small town or metro city, what matters is focus on excellence. And added, it is not just medicine or surgery that heals. What heals is listening. What heals is offering optimism. What heals is giving hope to the patient. That is what being a true doctor is about. And yes, I remember seeing that consultant writing beautifully with the fountain pen. And I am in love with that fountain pen that is with me ever since to remind me that lesson. My training took me from Vadodara to Mumbai, later to Japan and then to Toronto for my fellowship in spine surgery. At each step, I met mentors who shaped not only my surgical skills, they shaped my thought process. They taught me that path to excellence needs daily dedication, discipline, passion, and hard work. They also taught me to stay humble throughout. My dear friends, I'll take you to a place today, I call it a sacred place, where every life is valued equally. Whether you are a farm laborer or an industrialist, it doesn't matter. Everyone is treated with same enthusiasm and focus. My second home, that is Operation Theatre. I'll share some insightful stories that reflect the human side of surgery. Heart-warming moments, heart-melting, and yes, at times heartbreaking moments. So one evening, I got a call from an emergency department. I rushed. A young man became unconscious following a head injury. His CT scan showed a large blood clot compressing brain, needed an urgent surgery. At that time, I'm not sure whether he's going to make it or no, but yes, we did surgery in an emergency. And a month later, that same gentleman walked into my clinic with a big smile on his face, sweets in his hands, to tell me, Sir, I have passed my teacher's entrance test and I'm joining as a teacher. That day I learned the joy of saving a life. The person who was comatose, the person we were not sure is going to make it or no, that person joining as a teacher, priceless. At times, challenges are part of surgeon's life, as in every professional, every life, challenges are inevitable. This is the one I remember I faced in early years of my practice. This was a case of large brain tumor. We started at around 9 o'clock in the morning. The tumor was very vascular. As soon as you touch, it starts bleeding. And tumor was in such a crucial location that any bleed, if escaped at my vision, may lead to fatal consequences. That made me slow. Slowly we were progressing. We started at 9 o'clock. By evening, night, fatigue was setting in. I had leg cramps, but the thought of failure, thought of losing patient kept me going. And by the time we finished, it was next day 8 o'clock. So we lasted for almost 23 hours. I was tired, exhausted. Went home and slept. Got a call from ICU few hours later. Sir, patient is awake, moving all four limbs. And that single sentence made me fresh. My tiredness was gone. I was ready to go again. That day I learned, joy is not in surgical completion, it is in seeing the life return. At times, simple surgery can have profound impact. This was a young man, 19 years old, young college-going student, had a urinary incontinence. He could not hold urine, and that was since birth. He had to wear diapers. That made him lonely, that made him depressed, that made him socially awkward. He had a condition called tethered cord syndrome. Simple, straightforward surgery. And if you see him now, he is completely different person. He is full of life, he is jovial, he is in group. Such a transformative outcome, no money can buy. At times, surgery are real challenge. Like this was a young boy, 10 years old boy, who had a weakness in all four limbs, had a breathing difficulty. He was on ventilator but could not come out. Investigated, found out that he had a compression at the junction of brain and spinal cord, a place that controls breathing, a delicate place that controls all limbs movement. It needed a surgery. But such a weak child on ventilator, operating carries a huge risk. He may die on table. He may remain on ventilator for life. He may remain paralyzed forever. But we took up the challenge. A month later, his father sent me a video, that boy running and playing. Such a joy to see. From being on ventilator to full of life. No transactional money can compare the joy when you see this kind of outcome, neither for patient, family, or even doctors. But surgery is not always about success. At times, scalpel cuts deeper than we think, into our own hearts. One of my childhood friend's father had a lumbar disc surgery, needed a keyhole lumbar discectomy. Very simple, straightforward surgery, my area of interest, my area of expertise. I demonstrated that surgery on national platforms. But that day I failed. He had a vascular injury, needed a vascular intervention. A minimally invasive surgery became maximally invasive. But even that was not sufficient to save him. We lost him. I kept asking what I could have done differently. How could I do this mistake? Consoling self is difficult. To come out the operation theater and tell their family that you have lost your loved one because of my mistake. An even bigger challenge that no one notices for a surgeon is coming back next day, greet the next patient with a smile, and taking up the similar case with confidence that yes, I can do it. But yes, you have to go through this, and you can do it with imbibing spirituality. As Bhagavad Gita says, Nimit matram bhav savyasachin. You are just an instrument in the hands of God. This picture is at the entrance of my operation theater. That reminds me daily, be it success or be it failure, you are just an instrument. Everything belongs to Almighty. Bhagavad Gita also says, Karmanyevadhikaraste ma phaleshu kadachana. You are entitled for work only. Results are beyond your control. Imbibing this philosophy can give you balanced state of mind. You can embrace success and failure with the same stable mind. At times, as a surgeon, we have to think beyond scientific guidelines. This was elderly, frail gentleman. He had a cancer which had spread to cervical spine. That was giving him lot of pain. He was on morphine. He received radiation, but that was not able to control. He needed a surgery, but in such an advanced stage of life where he may live for few months, that surgery carried a huge risk and it was not recommended. Refused by many senior surgeons, but he pleaded, "Sir, I don't want to live with this pain. Make me pain-free. Even if I live for one day, I don't care. Make me pain-free." We went ahead. There were tense moments during the surgery. There was heavy blood loss, hypotension. The surgery took 4 hours, but eventually he became pain-free and lived for 3 months. Once he passed away, his daughter dropped me a handwritten letter. "Thank you so much, sir, for making my father pain-free. He passed away with peace and smile." That letter is still on my desk to remind me that surgery is not always about cure. At times, it is to provide comfort. With times, role change. From being mentored by amazing teachers and enriched by vast experience, now my role is to mentor a young generation. And what I try to pass on, apart from surgical skills, is this human side of surgery. To listen to the patient, to understand their concern, to be with them, be it success or failure, to be compassionate and work with just one single goal, to bring smile on the patient's face. In an era of robotics and artificial intelligence, that is what is more important to be, that is only we can do, to be human, to imbibe those values, to be sensitive, think beyond transaction, and bring this human side of surgery at the forefront. My dear friends, that is not only for surgeons, any field of doctor, any professional, whether you are a teacher, whether you are a doctor, whether you are an artist, an engineer, it doesn't matter. If everyone works with integrity and honesty, if everyone focuses on excellence, if everyone leads with empathy and starts sharing their wisdom and experience to the new generation, this world would be a much better place. That is the world I want to help build. That is the world I want to live in. And that is my appeal to the new generation. Let's come and create this world, because lives are not transactional. Thank you.